What do you do when a patient breaks down before your very eyes? How do you talk to the patient? What do you do? How do you handle the blame game and that type of thing? That's what we're going to talk about today in practical treatment planning. So this patient has been a patient of ours for a number of years. I'm a periodontist. He had a general dentist. He stopped seeing the general dentist about 2 years ago, asked us to take over the general dentistry as well because we have a general dentist in our practice. So that's the scenario. He's in his mid 60s, maybe a little bit older than that, maybe he's close to 70. And he breaks down. So I'm going to show you what breakdown means and tell me if you don't think that this would be a consideration. So here are his bite wings from, it's what, 7/13/22. Got it? All right. How about if we go to this one? You see the difference? So tell me, how do you feel about that? Caries breakdown. The caries breakdown is going on in other places. Well, let's go over the x-rays for a second so you can see this. You can see here's the full mouth series. You can see there are other areas of caries, although certainly the right side is worse than the left. But he lost tooth number 13 about 3 years ago. He lost 13. Then he's prone to caries anyway. He lost 13 due to caries, not due to periodontitis. Periodontitis is pretty well under control. He had a recurrent pocket show up on tooth number 19D. That's pretty much it. What happened to this guy? And what happened to this guy is something that we should all be concerned about because we're all looking at something where we've seen patient breakdown. What do we do about patient breakdown like this? Let me see if there's anything. Oh, yeah, there's one other thing I show you. Let me show you this. Okay, so now what you're seeing is a cross-sectional view of tooth number 29, and you see an apical abscess on tooth number 29. All right, so first question to ask. Okay, you see the apical abscess 29. You see it's already been crowned. No endo has been done. How many people want to get endo done? Do you want to get endo done on that tooth? And why? Say in the comments. If you want to do it, go ahead and do it. I looked at it. I don't want to do endo on that tooth. Why? Got a patient who's prone to chronic breakdown. Imagine drilling a hole, doing an endo, getting a successful endo result, and seeing the crown break off. And this kind of proneness to caries, we'll talk about that in a minute, essentially means failure. What a waste of money it would be to do endo. And I don't like the deep endodontic lesion. That's not good for your health. So yeah, we want to take that out. Let's go in a little bit more depth here. Okay, so you saw the severity of the caries. You see what's happened in 3 years. I said, well, okay, let's measure your pH. And what I do is I use pH test paper. You can get pH test paper on Amazon. It costs a roll of it costs maybe $20, something like that. And we see that his pH, at least according to this test paper, is 6.0. So he's got an acidic mouth. Is that the whole thing? I've seen worse. I've seen 5. That's a lot worse. 6 is not. It's not good, but it's not horrible either. So is that the whole story? I said, well, it's either got to be oral hygiene. So oral hygiene is pretty good. Acid or sugar. He said, I don't eat sugar. And so I talked to him, really, I'm really concerned about your health. This is breakdown, okay? And I'm seeing breakdown, which is causing bone loss at the end of your root, and I'm seeing breakdown in your teeth. I'm concerned for your health. Well, then he goes into his health a little bit. He's having some heart problems and things like that. He's seeing a cardiologist tomorrow. So there are other things that are going on. We dial into health, and because I'm concerned about his health, that's where he's talking about as well. And now when we're talking about health, we're getting away from the dental realm. We're getting away from how much does it cost going to fix. So we get away from all this dental implant stuff, crowns he's paid for that fail, and all the type of thing that, because we go to his overall health. And that's what I do in a case like this. Shouldn't I? This is his overall health. This is his problem. His overall health is just being reflected in his teeth. I don't eat a lot of sugar. I said, well, okay. What do you drink? Well, I drink fruit juice. I thought fruit juice is good for you. No, fruit juice has about the same amount of sugar as Coca-Cola does. Oh, I didn't know that. I drink fruit juice a lot. I thought it was healthy for me. And I don't belittle him at all. This is just, he says it, I acknowledge it. We're trying to help each other here. And that, those of you who've subscribed to me for a long time know that we've had successful dental practice. It isn't because I concentrate on how much we're going to get. It isn't concentrating on the implant or that type of thing. That'll come. It's the conversation that we have with the patient. Get the patient help, whether the patient can afford a lot or whether they can afford a little. That it is the trust issue that I covered in the last video. It is the trust. It's, I want to talk to him and I want to help you. And whether we're talking about a partial denture, we're talking about a full set of implants, that's immaterial. One costs this amount, this one costs this amount. You're going to have to decide which one you want to get. But that's not where we are right now. It's his health. So we got a fruit juice. And when I acknowledged fruit juice, it was then okay for him to share more information with me. So what information did he share? I eat protein bars. Those are good for you, aren't they? So what kind of protein bar is it? He didn't remember. I said, well, all protein bars have sugar. I know that. What do you eat? He said, well, how about Campbell's soup? So we went online and we looked at Campbell's soup and we looked at the label on Campbell's soup. It turns out this man does not know how to cook. And all he's eating is processed food. As I'm examining him, I see some other things as well. You ever seen something like this? How about that? See the ulceration at the floor of the mouth? Where does that come from? Well, as I'm examining him, I'm seeing his tongue moving all over the place. It's, I forget what the name of it is, dyskinesia of his tongue. He doesn't notice that his tongue is moving all over the place. So there may be a neurological problem here. Let me show you another video, another view here, and you see this. You see, I had him come forward, and you can see how he sticks his tongue out. Now, this is close to the floor of the mouth, and he's touching the incisal edge. I can't quite show it here, but you get the idea. He's touching the incisal edge of that lower tooth, which he must be doing at night. And so now he's essentially self-mutilating based on a neurological condition. He doesn't know that his tongue is moving, as I said. What do you call it? What do you do? You say, well, that might explain it. I think I may have had a stroke a few months ago. I had a stroke? Tell me about that. So, well, I'm not sure, but I've got pain in the back of my head right here. And I've had the pain in my head for the past 6 months. There's a problem. Okay, there's an overall problem. The dental problems are the least of his problems right now. Now, if we go back and we look at tooth number 3 for a second, so let's look at tooth number 3. Look at the current view here. And you'll see tooth number 3 is badly undermined by caries. So is tooth number 4, but it's not symptomatic. Are we going to spend any time on dental care for him? Now, I'm really not. I'm not, except for number 29. And I'll refer him to an oral surgeon for number 29 because, if we go to the oral surgeon for 29, at least we're getting rid of the apical abscess. Periodontal disease is minor. Get rid of the apical abscess as a contributor to his health. But then it's a letter to the, first the question is, all right, what about the foods that you eat? And the typical thing that I'll talk about a patient is, when you're shopping at our local food store, and Publix or in Florida, Publix is the one that many people go, or most people go to. Go around the outside of the store. That's where the good stuff is. Okay. And now I'm helping him with his health. Good stuff, fruits and vegetables in one place, going to meet or whatever it is, it's that place. And stay out of the center lane, center aisles. That's where the processed food is, where you'll find all the sugar. Take a look at the boxes. You'll see sugar. And sugar has different names. I say that to them. Maltodextrin is sugar. There are different things that are called, that are sugar that aren't called sugar. Well, he's taking all this in. So, well, I said, Super said, what I have an Instant Pot. I do have an Instant Pot. It's a pressure cooker. It's great. Yeah, you can pile the vegetables in there, whatever you want. You put I use some vegetable broth powder to add a little bit of flavor, and you just turn on the Instant Pot, and in 15 minutes you have soup. It's terrific. But even if you didn't, just pile vegetables, put some water in a pot, add some spices. You can get some Dano's spices, Publix, and sure enough, you have soup, and it's going to be healthy for you, and you're not adding sugar to it. He is taking this all in. He never learned how to cook. He's close to 70. So the next step is 2 steps. Number one, I do refer him to the oral surgeon. Not that we couldn't take it out, but he's got a number of medical problems going on. Let's go to the oral surgeon and get this out. But the second thing is, he's seeing his cardiologist tomorrow. I'm recording this today. I saw him yesterday. I dictated a nice long narrative, and without using his last name, I dictated into ChatGPT. My granddaughter did that. I dictated into ChatGPT, and I say this consultation on, and I give the first name, and then I put down the doctor's name, address, and phone number, and I dictate everything that occurred. ChatGPT. Now, I've been doing dictation my entire career. ChatGPT will put that into logical sequence, logical format, and then I've got a great narrative letter. I said, let me get this printed out. Can you stop over here tomorrow before you go over to the cardiologist? Absolutely. The cardiologist is right in our neighborhood, and he'll pick that up and give that to the cardiologist. When I've seen patients who've had consistent big breakdown, the common success that we have is to go to health. Now, I understand he didn't challenge me at all about we ignored this, we missed it, all the type of thing. But there are some that do, aren't there? There are patients who say you missed it, and we've got to go back to health. And what are the things that you are doing? And just start asking questions. And when you start asking questions with concern for overall health, you'll get some nice answers. Any questions, any comments, put them in the comments section. Good to see you.